Good afternoon. It is April Fool's Day, but for us and our communities, COVID-19 is a very serious matter. I am Ellen Jones, the Public Information Officer for the Anne Arundel County Department of Health. Welcome to the Health Department's COVID-19 Facebook Live broadcast. Today, our health officer, Dr. Nilesh Kalyanaramman, is joined by Bishop Reverend Larry Lee Thomas with Empowering Believers Church of the Apostolic Faith. Bishop Thomas will discuss the disease's impact on the faith-based community. And also, we have our department's behavioral health deputy, Tracy Shilden, who will address the fear, anxiety, stress, and uncertainty that many in our community are facing. They are answering questions provided by you in our Facebook AA Health comments or by email at covid19info@aacounty.org. So let's begin with a few public health updates from our health officer. Doctor?
Thank you. Thank you for joining us today in what is looking to be an ongoing series of conversations every Wednesday. Many of you are reading the paper, watching the news, and the messages become more dire each day. I certainly know that I find the news to be worrisome, in as much as we are all at the health department and in our community working on this issue. And so we really want to talk to you and answer your questions to be able to share information. One of the hardest things about situations like this is uncertainty, not knowing what it is that we're expecting, and not knowing how to prepare for that. And that's really the intent behind our weekly sessions here. So I'm going to start with where we are in Maryland at this point. We are just short of 2,000 positive cases here in the county. That number is growing. We're at about 160 now. That number changes throughout the day. And what we're really looking to understand is not just whether that number is going up, and that number will go up for the foreseeable future. What we're really trying to understand is how much is that going up each day. And that's really the question that we need to be asking ourselves and that we need to be looking at, because all these measures that we put into place around social distancing, they're meant to slow that growth down. That's really the goal of it. And so we are tracking those numbers daily to understand, is it still going up really fast, or is it going up less fast? Is it kind of leveling off? It hasn't leveled off yet. But we're trying to get a beat on that, because the other part of this is we know that if these infections are happening too fast, we have the potential of overwhelming our healthcare system. And that's not something we want to do, because one, that would lead to people who can't get care when they need it, and two, it would mean that we would see more deaths than we would otherwise expect. So, on that front, we're working with our hospital partners, with Anne Arundel Medical Center, with Baltimore Washington Medical Center, and we met with them, myself and the county executive, 2 days ago to talk about what their planning is, how they're escalating not just the number of beds they have, but also staffing, which is probably more of an issue, because there's only so many people trained to do this work. We're working with the Maryland Department of Health, the county's Office of Emergency Management, and the Maryland Emergency Management Agency to do this planning. So that process is underway. At the same time, though, we also know that our social distancing measures are going to have an effect. And as they have an effect, they will make that surge that we talk about less steep. And it'll also mean that this period of infections will go on longer. And so just in thinking about it, we talk about the worst case scenario a lot, but we also need to talk about what is likely to happen also as a moderate case scenario, which is that we see a number of new infections every day, but that it goes on for not just weeks, but months at this point. And obviously, that has implications for all of us in terms of how we live our lives, how we continue the way that we are, And that's a question that we will have to actively answer over the coming weeks. We don't have an answer at this moment, but we know that we're looking along both of those tracks and trying to map out what that looks like. I'm going to get to the topic I get asked the most often about, testing. So in terms of testing, I have better news to share with you today, which is that in Anne Arundel County, we've opened up 2 additional testing sites. One is in coordination with the Maryland Department of Health, and that's happening at the Glen Burnie vehicle inspection site. That's Monday, Wednesdays, and Fridays. I was there on Monday. I was there today as well. On Monday, I believe we did 8 tests, and we had many more scheduled. When I was there, just from 10 to 11 o'clock, I think at least about 12, 13 were done. And so that site is up and running, and that's really exciting. We also have at our County Department of Health on Harry Truman Parkway, we have a testing site there that's open Tuesdays and Thursdays. And yesterday was its first day of operation. We did 11 tests. We have more scheduled for tomorrow. The Glen Burnie site is really focused on getting as many people through as possible. Our Anne Arundel County Department of Health site is focused on really targeting those people who don't have access to primary care, who might be uninsured, or who might have other limitations such as disabilities and require some additional assistance to get testing. And so you can call the Anne Arundel County Department of Health for information on how to get that testing, and if you don't have a primary care doctor, we can screen you and see if you're eligible for that. Our phone number is 410-222-7256. As much as testing is important, both for the person who might be sick with COVID-19 and also for us in public health to understand what's happening in our community, the other part of that is contact tracing. And this is the part where you really have a lot to do about how we can limit the spread. If you have symptoms of COVID-19, we ask you to isolate, which means you stay where you are, whether that's at home, in a facility, or if you need shelter, seek help, and we can direct you to that. It's really important that you do that, whether or not that COVID-19 test, you get it, or whether or not it's positive, until your symptoms are over. We are all used to pushing through our cold and flu symptoms. Don't do it. Now is the time not to do that. At the same time, for people who are coming in contact with you, that's the time to quarantine, and we can answer your questions about quarantine if you give us a call, but that's when people who are in contact with somebody with symptoms voluntarily stay away from others until we see whether you develop symptoms or not. It's a way to prevent the transmission of disease. Our team has committed to doing contact tracing on everybody who is positive in this county. Normally, in a normal month, that's a handful of people each month. Right now, it's a number that's growing by the day, and we are ramping our staff to be able to do that, to be able to do over 100 new cases per day. That is a tremendous amount, but that is our commitment to being able to stop the spread of this disease. I want to finish up by reiterating the most important parts, which is the social distancing. The governor put out a stay-at-home order the other day on Monday, and the intent of that is to really push home the message that each of you, are responsible for our community. You know, we may think that it's okay if we get sick, but what we're finding out is that the people who are hospitalized is pretty evenly split between those who are under 50 years of age and those who are over 50 years of age. So while we talk about the deaths happening in an older age group, the hospitalizations are happening in a wide range, pretty much across the entire adult age range. And as much as you may not be worried, or you remember that what you do affects others. And so we ask you to maintain those social distancing techniques, telework if you can, avoid groups. If you have to go to the store, if you see a line, wait. Don't go stand next to somebody waiting to get in. And make sure you're doing your good infection control, washing your hands frequently, using hand sanitizer if you can, making sure that you cover your coughs, sneezes, and disinfecting frequently touched surfaces. The last thing I'll mention is that this is rapidly changing. Guidance that we offer last week, as we learn more, we may change. it's challenging to keep up with it for those in the public health field. It's that much more challenging for the public at large. And so make sure that you're looking for reputable sources of information, whether that's the county health department, the state health department, the CDC. Make sure your sources of information are reputable and that you're checking somewhat frequently, a few times a week at least. And so with that, I'm going to turn it over to Bishop Thomas to talk a little bit about the efforts that he and his congregation are making, and also the impacts this is having on the faith-based community. Bishop?
Thank you, sir. Good afternoon, everyone. It's a privilege and an honor to be here on this panel representing our faith community. My name is Bishop Larry Lee Thomas. I pastored the Empowering Believers Church located, I call it, the beautiful city of Glen Burnie, and also I chair a group of ministries called the United Black Clergy here in Arundel County. So when I come representing the faith community, I pray that I have the voice to be able to speak on their behalf. Because one of the questions that was asked, what items do you see the community needing at this time? And when I begin to think about this question, I said, first, I want the people to recognize the faith community is a community. They play a very important role in making sure that the needs of the residents of this county are met. And the partnerships that we have developed, especially even one with the health department down through the years, I use the word called relationship. Over the years, because of the relationships, when we have to deal with finding the needs, when we think about our food pantries, we began giving away food in our community. Then we found out there was a shortage, and then we found out there was no meats. And these are the challenges that we are still facing, because there's many food pantries who have been operating once or twice a week, or some of them on monthly, or by people calling in. We find out these needs are quite serious, because people are having that what we call fear. They don't want to be caught without having certain items. And even when we get the vulnerable citizens, especially our senior citizens, we have to make sure we do special packaging and those things. So when I look at what do you see the community need, we need the continuous support from our community when it comes to the food pantry. And then we also we found that we had opportunities, and we still need to have all of the protective gear that is necessary, because when we are out doing what we call the servant ministry, we just don't want to expose someone else. So we want to follow all of the regulations that has been given to us. But then the items we also need is a continual line of communication. And I know our health officers talk about having that connection with our elected officials and those other nonprofits and organizations that are working out there. I just got off of a call with Senator Ben Cardin and Senator Van Hollen addressing some of the what the stimulus package supposed to give, and our congregation people are asking, do I qualify for this? Do I qualify for that? So we have to be ready to give them what I call a reasonable answer. But then I find out that, again, that's why they say go online. I say there's many people who don't have the ability to go online. So we are, again, looking at opportunities like this to get to that broad audience. We do a broadcasting on $4.99 or $99, and some of the churches have initiated some of their service, and people are asking for more of that. They want to see someone that they know, because that's the voice, what we call, of confidence. with the Easter, and we say the first thing we talk about is Holy Week. This is the beginning of getting to the observance of Holy Week, because Sunday represents a time what we call Palm Sunday. It was a time of celebration where the Jewish and the Christians, they took palms and they dropped at the along the path as Jesus made his way into the temple. And right now people are wondering, what am I going to do on Sunday? And then we have to find the words to encourage them. We have to start thinking what we call outside the box, but making sure that their belief system is solid. And that's one of the things people have been working on, we call increasing faith, times of prayer. But then we ask, the question is, when Easter's coming, Passover's coming, all of these wonderful things are coming, some of the ministries, thank God, they have the capability of doing some of the observance. From a collective group of churches, we are going to hopefully make that same sound. There's hope still on the way. So people are going to be looking for hope, and the church represents that. The faith community represents that. I get many times when people say, Bishop Thomas, I seen you on television. Bishop Thomas, I seen you on this thing. Bishop Thomas, I seen you this way. And it encourages me to know that I can be a representative or a voice for the faith community to make sure that we are being pointed in the right direction. Like, again, people are asking, can I do that? We still know that there's a limitation of a certain number of people that can be in the building or doing certain things. And then again, what we found out, which is good news, is our pantry is considered an essential place, so we can call some of our volunteers to come and help out. And I was talking to one about coming out and helping. She whispered to me, she said, Bishop Thomas, I suffer from depression, I suffer from anxiety, but being out here gives me some hope and relief. So when we say it's the faith community important at this time, those areas of ministry are very important. We even have what we call a Eden rain garden, even at the church, that even sometimes some of the people comes and pour the weeds, preparing the rain garden for this wonderful season. So to keep the faith community activated, we want to be able to continue to let them know that there are opportunities. It's what impact has the coronavirus have on your congregation, and how do you address those changes? Well, the impact that it has, that people are not gathering, finances are not there. We're finding out many are without jobs. So what we call the lifeline of the church is not there when it comes to the financial. And even when they talk about the stimulus package, didn't help many independent churches, and people are still going to be left out. And that's one of our biggest concerns, because those underserved are sometimes the last to get that wonderful information. So on our congregation, like, we can't have our regular worship. That's the high time of the week, your worship service. And now that that's taken away, people have learned the skill of going viral and using all kinds of, whether the Facebook, Instagram, and the other technology that can help people stay connected. And we've been trying to do our best to bring people up to the next level. But we find out that some of the basic things that sometimes the needs, people are still needing. And one of the things that need, I always say every now and then, I give them a hallelujah wave. And those type of things that through the church experience, we find those are things that strengthen us. And they say, how can people stop the stigma and the stereotyping that is sometimes related to COVID-19. I could say in the circle that we are in, I don't see the stigma and the stereotyping, and I'm glad. we we have learned through church culture to respect people wherever they are, and now we're practicing that, and so to look at stigmas and stereotyping, these things are something that we don't have to address in our church setting. But now some others might speak differently, but I have not seen. I've seen people when they say, "Pastor, I can't hug you," and then with Dr. Ness, she said, "Go to prayer simple." So we're learning. And that's the greatest thing. If we can learn how each person represents this wonderful culture and how we can overcome the stigma. And that's one of the things that if there is a stigma, this is what we call the Holy Week. We give us to heighten the more respect that we have for the different faiths. I've been getting different calls from different other faiths, a time of prayer, a 24-hour, knowing that this is a very special time in the culture of the church, during the Jewish culture, and how that faith community needs to work together to have what I say, that one sound and that one message. Then say, am I at risk if I go to a funeral, visitation service for someone who died of coronavirus? Well, one of the things I always share from the time that when 9/11 happened, the different things happened in our country, we have, as the faith community, also said that we are part of what we call the first responders. So what's that saying? We have to learn how to be able to go. I got a call last night. My cousin was taken to BW, to the hospital, and then this morning her sister called and told me she had passed. And again, myself being limited and thinking now, how do you console the family? When I talk to funeral directors, they say, well, Bishop, we can only do certain things according to the guidelines. Now people, loved ones are not, that had services planned, have to go through what I call alternative plans. And this is what I call heart drenching. It saddens us. Even when I thought about, I got the information with Bishop Palmer, one of his members was involved in a car accident. She was one of the volunteers to come help out, and she passed the other day. So these are hard things when you have to know that people have to go through things alone. But one of the things that we keep encouraging, we must keep our faith in God. I see certain things that are given, and one of the things that they were saying, we are dealing with a disease called coronavirus. It's a virus, it's a small virus that making a big impact all over the world. But then we've got hope out there. We say now, if this coronavirus is making that kind of impact, we were taught through the scriptures, if we had faith as a grain or a seed of a mustard seed. The mustard seed, one of the smallest seeds one can ever think of, but at the end of the day, it flourished into a great plant. So what we're saying during this time, let's keep giving people hope and practicing faith. We say we won't be able to see you, but we'll be able to say something to you, and continue to encourage you to hold on to your faith. And even like on Palm Sunday, it's a day that we give out the palms. And people say, well, Bishop, are you going to have the palms? I said, yes, I'm going to have some palms. So people, we have to try to strategic how to make sure that person can get a palm without going against what we call all of the mandates that has been given to us. So those are challenging things. But we are still believing that people's faith and hope can increase. And then we're saying people keep calling this Armageddon. Well, for those of us who are astute or Bible learners, according to Matthew 24, there are certain signs that has always come, whether we have seen them in earthquakes, we have seen them in other disasters, but we cannot determine what is Armageddon. All we now can determine is if we keep our faith. That's the thing that I kept on reading. If I keep my faith during these critical times, my faith as once it can make me whole. So I would just want to encourage the people, whether it's the Armageddon or because the Bible always said these are the beginning of sorrows. And you could go and trace a year after year where we see these things happen. But yet, we can still have that hope that the end is not yet. And we will be able to hug one another again. We will be able to shake one another's hand again. We're going to be able to go back to the malls and to the churches, and oh, what a day, or what we call it, a rejoicing that would be. Because that's the hope that we're looking for. After this pass, we always make a statement, this too shall pass. So for all of those that are watching, just remember, we are going through it, and we're going to come out with victory. Thank you.
Thanks so much. Thanks so much, Mr. Thomas. You responded to all of the questions that were religion-based that we have received, but it's very thorough and very inspirational.
Thank you.
Thank you. Tracy, we have some behavioral questions for you. With social distancing, how is the health department providing counseling and therapy to individuals and families?
So the health department is continuing to provide counseling and therapy to individuals and families. We are doing that via telehealth as well as on-site by appointment. We've been able to create adequate space in our offices, as well as to make sure we have all infection controls in place. The Adolescent and Family Services Program provides behavioral health services to youth ages 4 to 18 and their families. You can reach them by calling 410-222-6785. Right now, you would be leaving a message, and we would have a staff person respond to you promptly. Both of our Road to Recovery clinics are still in operation and providing medication-assisted treatment. We do have some reduced hours, and all new appointments, all new intakes are by appointment only, so that we can ensure and allow for social distancing. The clinics there can be reached at 410-222-0100. Again, you would leave a message, and a staff person will respond in a timely manner. We've also expanded our Wellmobile services. The Wellmobile provides low threshold buprenorphine induction, gets people stabilized, and then helps connecting them to a provider in the community for continued treatment. Given that the Wellmobile is basically an RV with confined space, we are no longer providing those services there. We've moved them to our clinic at Langley. We are only providing on-site services on Tuesday, but we have now added virtual services to our Wellmobile, where we can, if the individual has audiovisual capability, we can do the intake as well as prescribing using telehealth, and we can do that for any individual throughout the county. We're not limited geographically, since it's virtual. You can reach the Wellmobile by calling 410-UB-WELL, and that is 410-823-9355. You will leave a message, and one of our recovery peers will reach out and get that service started for you. We also have peer support services. If you're not in need of treatment or counseling, those services are still available. You can, that number is 410-222-7076. And this county is very fortunate. We have an extensive network of treatment providers who have stayed committed to meeting the behavioral health needs of our county. They've started telehealth. They've still offering on-site services using proper social distancing and infection controls. And if you can contact them directly, or if you would like a referral, you can contact our resource line at 410-222-0117, and they will provide you more information and assistance with making those linkages.
Thanks, Tracy. I have a few questions from parents. Our children are very worried about their grandparents dying. How should we handle their fear?
So the best thing when talking with children is always to be honest and sharing them information in an age-appropriate way, but also in a messaging that is positive. So for example, you can acknowledge that the virus can make older people more sick than younger people, and then say that is why Grandma and Grandpa are staying in their house, and we're not visiting them. We're using telehealth and the phone so we can have contact with them. You can ensure them that their grandparents are healthy and that they're staying at home, and also limit their exposure to TV. Let them know that the majority of people who are getting the virus are going to experience symptoms like a cold and recover. Unfortunately, the TV is more focused on those dying, and that's the message that they're going to get. So it's important for them to know that that is not happening to the majority of the individuals. This is also a good time to discuss and reinforce all the ways they can help to stop the virus by washing their hands, not touching their face. I have a hard time with that. I think we all have a hard time with that. And also using a Kleenex. This is a good time for them to learn those skills, and throwing it away after they sneeze. And it's also helpful to provide some distance between their fear by ending on a positive note, like engaging them in a very happy discussion of, what do you plan to do when we're finally able to see Grandma and Grandpa, right? Let's make plans about that so they can get excited. And making those plans for the future will help provide them that hope and that comfort.
Teenagers,
Oh, Lord.
do you have any advice on how to live in a condo with teens and young adults 24/7 and keep our sanity?
I'm not exactly sure a condo matters or not with that, but it's a great question, and I think it's one probably our young adults and teens are asking about how they can survive with their parents 24/7. I have a interesting story with myself in that, I've been teleworking from home for 10 days, and I have a college-age son who's doing all of his schoolwork virtually, and I happened to text him to say that the Bluetooth thingamajig that intensifies my sound from my computer was not working, and he texted back immediately saying, "I am not the IT person." So apparently I was calling upon him a lot. So what can we do? One of the things is to establish a nice regular routine so that we are doing the same things and we know what to expect and when they're going to happen. Posting a schedule is helpful. Many of these teens, as well as young adults could be in college, are doing their classes virtually. And so everybody needs their own space to be able to do that. So if you have a nice schedule that's posted, we know when mom is doing telework in the kitchen and brother's doing homework in the bedroom, and then you have the dining room. So it seems like we're spreading out throughout the house. So it's also important with the schedule because it reduces conflict. And it's important to talk about any potential conflicts early, because this helps us in deciding where our good space would be to carve that space out. And when we talk about space, you know, we're very lucky we have all this technology. Space can be an actual room, but it can be creating a space, I don't know how other to say it, but, you know, with headphones, right? You know, you have, many of you with the kids, they put the headphones on, you talk to them, they don't even answer you. They've created their own little personal space. And knowing that they're doing that and not invading that space because you know that they're reading a book or they're listening to some music that's helping them deal with the fact that they're in isolation with you. Something that's come about has been baking, right? I mean, I can't hear enough about all the baking stories that people are doing. And one of them that's really interesting is, you know, because this is an age group that's relatively safe in the kitchen now, teens and young adults. You may ask them to have a competition, your own cooking war. You know, here's some, look through the pantry, look through the freezer, see what we have in the refrigerator, who comes up with the most creative meal. And then allow them time to have socialization with their friends. And most importantly, for us to deal with being with each other for 24/7 is our own self-care. You want to make sure you have enough sleep, make sure you're eating right, exercising, do whatever you need to do to feel fulfilled and strong. Because if you're better able to handle stress if your mind and body are strong and healthy. And give yourself some slack. Be kind to yourself, because things are going to get stressful. Things are going to start to wear thin, and you might freak out, and it's going to happen. And the best thing to do is acknowledge that and normalize it with your kids, right? This is going to happen, and then model how you can get right back on track. And good luck.
Now, Tracy, this is another Family Matters question. What is the best way to politely remind someone about social distancing when they always get right in your face?
Oh, that's as a mother, that's a very difficult task. The best way is to just keep reminding people that this is how we can stay healthy by keeping that distance. Share with them ways that they can keep that distance. You know, if you have teenage kids, this is a great time now to let them do all the text talking back with you instead of having to come talk to you, kind of a thing. And keeping stuff throughout the house, like making sure that there's wipes and sanitizers, because then you're actually promoting that message within there.
Thank you. Back to doctor and social distancing. Where we got this question, why can't you share specific areas in Anne Arundel County that have positive tests so residents can be aware and vigilant and be distant from those people?
So that's a good question. We are now looking at providing some data by zip codes, and we're looking to do that in the next few days. We have enough cases. We always want to maintain that balance between privacy for individuals and providing enough information for the public to manage their health. So we'll have that information by zip code, we're hoping, in the next few days, and we will put that up on our website once we have that.
Thank you. Quarantine. What exactly is the difference between stay at home, self-quarantine, and isolation?
So we'll start with isolation. Isolation is when you have symptoms of COVID-19 or you've been diagnosed with it. And isolation means that you are staying by yourself in a space away from others and avoiding contact. That's what isolation is. Quarantine is for people who don't have any symptoms. And so those are people who have been exposed in one way, shape, or form to somebody with symptoms or with a diagnosis of COVID-19. And they're doing the same thing in terms of staying away from others, not interacting with others. But that's the distinction between isolation and quarantine. And typically for somebody who's in quarantine, they're really, if the person who's in isolation, we don't know their COVID-19 status, and then we find out it's negative, they can come out of quarantine, because we're really trying to make sure that if they were exposed, they're not exposing anybody else. And if they were in contact with somebody who's known to have COVID-19, we can often say that you need to be quarantined for 14 days, so that, because most people develop symptoms between 2 and 14 days. That's the period of time we think that if you haven't developed symptoms by then, you should be okay. And so those are determinations we make based on the history of a person's exposure, and we walk it through each individual as that comes up. Stay at home is the order that was put out by the governor on Monday, and that's a broader, more societal question of really asking people to stay at home or where they are residing, as much as is possible, with some small exceptions. We talk about essential services and what those are, and we can and that information we've shared out on our Facebook feed. But unless it's for essential services, either you're a worker or you're getting those services, or to go for a walk by yourself. The idea is really to not be outside where there are more opportunities for people to congregate. It's to decrease the chances of people congregating.
Doctor, if a family member is confirmed or suspected of COVID-19, can they still share the bathroom, make dinner, and other chores? And what restrictions should they have to protect the rest of the family?
So ideally, if somebody is confirmed, either has the symptoms or is confirmed, they should refrain from those sort of communal activities that are not necessary as much as possible. Good example is cooking dinner. If they're the only one that has to cook dinner, and that can happen, and there isn't anybody else to do that, there isn't anybody else who can help with that, then they should do that activity by themselves and then wipe down the area afterwards, and really not have that meal with others in their household. That's really the type of isolation we're talking about, and when others come to eat that meal, they should be wiping down those surfaces before they start eating. Oftentimes, bathrooms are going to have to be shared. Most people don't have enough bathrooms for everybody to have their own. But you can set up a time where somebody is going, for their morning shower. Obviously, you can't predict times during the day, but you can certainly come out and see. That person can come out and see if anybody is in the bathroom. They go right back, and if they do go in, they wipe down everything in the bathroom that they're touching afterwards, and those who go in wipe it down before use. So those are some of the things that you can do when you have to share a space. You don't share the space at the same time, and you maintain good hygiene in terms of wiping surfaces down and doing hand washing to minimize the spread in that household.
For symptoms, doctor, the media reports more symptoms of COVID-19, such as loss of taste, stomach upset, sore throat. Are these proven signs and symptoms or just coincidence?
No, we have pretty good sense that those symptoms occur. The symptoms that we're really looking at, when we keep focusing on cough, fever, and shortness of breath for a reason, those are the symptoms that are not just most likely to occur in COVID-19, but are also somewhat specific to it. With the fevers, we can see that particularly people who are not doing well can have fevers that last days and days on end. And you typically don't see that in the flu. You do see it a little bit. Shortness of breath is not common in the flu at all. You don't see that in colds unless you have some other lung disease. And so that's why we really focus on fevers, which over 90% of people who exhibit symptoms of COVID-19 have, the shortness of breath, which is a very frequent occurrence. We're also hear reports of loss of smell, loss of sense of smell, loss of sense of taste, diarrhea, sore throat. That doesn't happen in as many people, and it's not as reliable. Generally it's more likely for you to have those symptoms along with some of the others. But I think that I want to go back to something I said in the beginning. Our knowledge about this is changing constantly, and we can update that. 2 weeks ago, we wouldn't have talked about the loss the sense of smell or taste. That is information that's really been just coming out in the past couple of weeks. So as we learn more, we look to update our guidance on what to look for and also how we're screening for it. So it's challenging if you're trying to stay on top of it. What is real and what is just what are just stories, and that changes a lot.
Another story could be about masks. The CDC said masks are good for people who are sick to wear to prevent the spread of disease. But since asymptomatic people can spread COVID-19, shouldn't everyone wear a mask, bandana, or a scarf?
That is a great question. We actually talked about that this morning. Myself and our director of disease prevention, our knowledge of how COVID-19 is being spread, and also how many people are asymptomatic and are transmitting is growing by the day. We are looking at other countries particularly that have had more, not just more mask usage, but also more strict social distancing policies, governmental policies, and are looking to how that informs what we're doing. So for the masks piece, we're really looking strongly at what is the effectiveness of masks and what do they need to be. We've focused on the surgical masks, the N95 masks, to reserve those for healthcare workers and other first responders. But if you have a homemade mask, I think it's perfectly reasonable to wear it, and we're working in our department to figure out what sort of guidance we want to put out. So be on the lookout in the next day or two around our guidance on that.
Thank you. Another comment was about masks and gloves on the ground outside of grocery stores. They asked, can someone get COVID from picking up those old masks and gloves? And what is the best way for people to dispose of used masks and gloves?
The best way to dispose of it is to throw it in the garbage. Don't throw it on the ground. That's sort of a truism throughout life. Don't throw stuff on the ground. But if you are in the position where you have to clean up of that sort of trash, we would recommend that you're wearing gloves when you're doing that, and of course washing your hands afterward. We've talked about how long the COVID-19 virus can live on objects. Generally, for hard surfaces, it's at least 3 days. For more porous surfaces like masks, it's up to a day, and so you really don't know how long something has been there. You want to take precautions before you pick it up.
Thank you. And another grocery store comment. People are going to the grocery store. That's an essential place to be.
Where we have to go.
Yes. After I run errands outside, do I need to change my clothes and shoes? And how long does you mentioned this, how long does the virus stay? But how long does it stay on clothing?
Yeah. Answer the clothing part first. We typically think that it lasts up to a day on clothing because it's a porous material. We don't necessarily recommend that you have to change your clothes and your shoes if you haven't come into contact with others, but if you have come into contact with other people, or you are in an area, and this is true for healthcare workers, where there is a high concentration of people with COVID-19, then we actually do recommend that you change your clothing. When you get back home, make sure you wash your hands. And for healthcare workers, the recommendation is actually to take a shower when you get home.
With hand washing, if someone is at home all day, do they have to frequently wash home alone all day? Do they have to frequently wash their hands?
If they're at home by themselves, nobody else is there, nobody else is coming or going, and they haven't done anything else, you should be okay. We're really talking in the context of when you're engaging with others, and even though it may seem innocuous, if somebody comes and delivers a package that's packaged to your house, and that's happening more and more, or you're getting takeout, let's say, something like that, that's the kind of instances where you want to make sure you wash your hands.
Thank you, Doctor. We have some questions related to substance use. So, Tracy, my partner and I are drinking much more since COVID-19. How does someone know the difference between drinking to relax and becoming an alcoholic?
So alcohol is embedded in our culture. We see that in that alcohol, liquor stores are essential services. And restaurants have been given guidance that they can deliver alcohol carry out. We use it to celebrate, we use it to help ease the stress of everyday life. And right now, there's pretty much a lot of stress going on in everyday life. So it's not surprising that people may find themselves drinking more than they intended or more than they did before. It does provide a temporary relief, but in the long term, it is not an effective coping mechanism. It disrupts sleep patterns, so you're not getting enough sleep. It also disrupts healthy eating and getting involved in other healthy activities like exercising. And it's important. Those things are very important to keep your mind, body, and spirit strong. And that's particularly needed for you to be able to cope effectively. With that in mind, some of the questions I would ask, are you drinking earlier than you were the day before and the day before that? Are you drinking more than you were? Have you stopped? You know, a lot of your activities have been stopped because of the virus, but if you were doing things in your home for self-care, like exercising, yoga, reading a good book, cooking a good meal, and those things have stopped now because you started drinking, those probably mean that your drinking has started to become problematic. But just the fact that you're asking that question probably means that you're a little concerned about the alcohol use. And so you might want to start implementing some other ways that you can cope with what's going on right now. And we talked about that, taking a walk, exercising, watching a lighthearted movie. There's meditation, practicing breathing, reading a good book. Taking a hot shower and a bath can help relax you as well, even more effectively than the alcohol can. If you're still not sure, if you feel that you're having some problems or struggling with reducing your alcohol input, you can reach out to us at, I gave that number before, 410-222-0117. And there are clinicians there that can answer your specific questions and help tailor guidance specific to your needs. And we also have the peer support services, and that's 410-222-0, got that wrong, 410-222-7076. There's a lot of numbers.
Opiates. Since the COVID pandemic, you don't hear much about the opiate epidemic. Does the opiate crisis still exist? And does the health department still offer the free Narcan kits?
So while the urgency of the pandemic has taken over the news, it has not taken our attention away from opiates and the impact it's having on our community. In fact, we're even being more diligent in watching the data that's happening, the overdoses, so that we could potentially mitigate any of the negative harms that the virus may be causing to those who are using opiates. As I mentioned before, treatment programs continue to remain open, and recovery support groups are also available virtually, as well as our peer support services. Safe Stations is still in operations, as well as the crisis beds for those who are using opiates and are looking for treatment and cannot find an open bed. And while we have stopped providing overdose response training in group settings, we are providing the kits free to continue to do free kits to anybody who needs them. So all they have to do is call another number, 410-222-1937. I'm actually going in tomorrow to help make some kits because we've had several requests, so you can definitely access those kits.
And let me add that we don't hear a lot about the other issues that we talked about, but we are still monitoring those. We are still providing a base level of services. We follow the overdoses. I think 3 weekends ago we saw a rise in overdoses that was very concerning, and we've been tracking that, and it's gone back to it's gone back to a more routine level of overdoses, but that still was always too many. And that's why we expanded our telehealth services for buprenorphine during this time of COVID-19. So it's still very much on our mind.
Thank you. And thank you all for joining us today. We've touched on the mind, the body, and the soul with this program. And Dr. Nilesh, would you like to have closing remarks?
Yeah, my last thoughts are to be kind to others. This is a trying time for all of us, and we each have the ability to offer our empathy and kindness to others, that same empathy and kindness that we need during this time. So with that, thank you for joining us this week.
Yes, thank you. A hallelujah goodbye.